Why are plastic surgery patient privacy rules not the same globally? Imagine trying to keep a secret in a different country where the rules about privacy are completely different. That's what happens with plastic surgery patient privacy around the world. The main reason is that each country has its own laws, cultural values, healthcare systems, and technology levels that shape how patient information is protected. In some places like the European Union, privacy is considered a fundamental human right. They have strict laws called the General Data Protection Regulation, which requires healthcare providers to protect personal data, including information from plastic surgery patients. These rules are very detailed and enforceable. But in other countries, privacy laws might be less strict or focus on different priorities. For example, the United States has the Health Insurance Portability and Accountability Act, which protects health information but only within U.S. healthcare providers. This means that privacy protections can vary a lot depending on where you are. Cultural values also play a big role. In some societies, individual privacy and autonomy are highly valued, and patients expect to have full control over their personal health data. In others, family involvement in medical decisions is common, and sharing information with relatives might be expected or even encouraged. These cultural differences influence what patients expect and what healthcare providers are allowed or expected to do when it comes to privacy. The way healthcare systems are set up and how advanced their technology is also matters. Countries with modern electronic health records often have specific rules to keep digital data safe and give patients control over their records. Countries with less digital infrastructure might have fewer or different privacy rules, which can affect how plastic surgery patient data is stored and protected. Professional standards and ethical guidelines in plastic surgery also differ. Surgeons are expected to keep patient information confidential beyond what the law requires. They often have guidelines about how to handle patient images or data used for education or marketing. These standards depend on local laws and cultural norms, so what's acceptable in one country might be different in another. In summary, the rules about protecting plastic surgery patients' privacy are not the same everywhere because of differences in laws, cultural values, healthcare technology, and professional ethics. For plastic surgeons working internationally or with diverse patients, understanding these differences is essential to respect patient rights and follow the law. Always remember, patients should consult qualified healthcare professionals for personalized advice and to ensure their privacy is protected according to local standards.